Continuing with the muscles associated to the spine, we have right here an anterior view of the axial and subaxial region. We can identify the hyoid bone lying at the same axial level of the body of C3. Superiorly, we see the suprahyoid group of muscles from medial to lateral, the genohyoid muscle, the anterior valley of the digastric, the mylohyoid muscle, stylohyoid muscle with a superior attachment to the styloid process. Laterally, the posterior valley of the digastric muscle that is going to have an attachment on the digastric group, which lies just medial to the mastoid tip. Inferiorly, we have the infrahyoid group of muscles from medial to lateral, the sternohyoid muscle, the thyrohyoid muscle, and the omohyoid muscle, which runs from posterior, lateral, and inferior to anterior, medial, and superior in an oblique fashion. And this is a relevant muscle when we're aiming to approach the cervical region from an lateral corridor, and sometimes can be on our way when reaching any region below C4 or C5. We're seeing all this after removing the platysma and removing the sternocleidomastoid muscle. In a deeper plane, what we see right here is from medial to lateral the longus colli that has three parts: a superior oblique part, a vertical part, an inferior oblique part. The superior oblique part, or the most superior attachment, happens at the anterior tubercle of the anterior arch of C1, and laterally we see the longus capitis that lies just lateral to the longus colli. It has an attachment over the basilar portion of the occipital bone. In a deeper layer, we see the rectus capitis anterior, and laterally the rectus capitis lateralis, connecting from C1 to the basilar and lateral portions of the occipital bone. We can also see the vertebral artery, the right vertebral artery, that is going to enter the transverse foramen at the level of C6 conventionally. This is an anterior view of the abdominal muscles. We see the external oblique muscle that has an origin on the lower 8 ribs and attaches, because right here in this dissection we remove partially this muscle. It attaches to the kyphoid process, and also has an inferior attachment over the anterior 2/3 of the iliac crest. In a deeper layer, we see the internal oblique abdominal muscle that has an attachment inferiorly over the anterior 2/3 of the iliac crest, and also a superior attachment on the lower 3 to 4 ribs and kyphoid process. It has a medial attachment on the pubic crest. And superficially, we see the rectus abdominis muscle that runs from superior to inferior. It attaches inferiorly on the pubic crest, and also has an attachment over the anterior pubic ligament. Superiorly has an attachment on the kyphoid process and part of the costal cartilages from the lower 5 to 7 ribs. The inferior to, or in a deeper layer, we see the transverse abdominis muscle that runs, as the name says, it runs in a transverse fashion from the pubic crest to the anterior pubic ligament. It has an attachment over the kyphoid process and also the costal cartilages of the lower 5 and 7 ribs. In between these two, the rectus abdominis and the transversus abdominis, there are going to be epigastric neurovascular components that are relevant during an anterior approach to the lumbar or lumbar sacral region. We have right here the umbilicus, which is serves as a reference and is usually aligned with the body of L3, L4.